Before we get into the specifics of the RFP, we just want to start by giving everyone a little bit of background on the department, on COVID, and on its impact on suburban Cook County. And this background will make it clear why we are looking for such significant support for our contact tracing program from community-based organizations like yours, and why this help is really needed. So we'll start with the department. The Cook County Department of Public Health is the state certified public health department for almost all of suburban Cook County. The city of Chicago, Evanston, Oak Park, Skokie, and Stickney Township are actually served by their own certified health departments. But CCDPH serves the rest of suburban Cook. Our work at CCDPH, whether supporting policies like the minimum wage and earned sick leave, investigating communicable diseases, case managing high-risk infants, or preventing tobacco use, is always focused on advancing health equity for all people. Next slide, please. Thank you. So CCDPH has been integral to the COVID-19 response in Northern Illinois since the very beginning. And on the slide, you can see some data that we're monitoring. As of September 14th, these are the number of confirmed cases and tragically the number of deaths in suburban Cook County due to COVID-19. Just to provide a little bit of context on these numbers, last year, for the whole calendar year, suburban Cook County saw about 20,000 communicable disease cases in the entire year. And so far this year, as you can see, we've had nearly 56,000 cases of COVID-19 alone in suburban Cook County in just a little over 8 months. Next slide. As I'm sure everyone on this call is already aware, we're seeing really significant disparities in the impact of COVID-19 on different communities. And of course, we are significantly troubled by the disparities that we're seeing. There are considerably higher rates of COVID-19 illnesses and deaths among African Americans and Latinx people. In suburban Cook, our jurisdiction, the rate per 100,000 Black residents is about 3 times higher than white residents, and the rate for Latinx residents is almost 4 times that of whites. Of course, this is not surprising to those of us who work in public health, as Latinx and African American residents have historically been disproportionately affected by heart and lung diseases, cancers, diabetes, and all of the other underlying conditions that put them at increased risk for more severe illness and even death from COVID-19 and other chronic and communicable diseases. Unfortunately, these health outcomes are the result of years of racist and discriminatory policies like redlining, numerous barriers to accessing health insurance and healthcare, and of course, unfortunate overall decades of community disinvestment. COVID-19 is revealing these health disparities that we've long known are rooted in historical discrimination. And even worse, COVID-19 is likely to worsen or deepen these disparities further if we don't work together to address the inequities that unjustly affect suburban Cook's communities of color. Next slide, please. So CCDPH has been, as I mentioned, really involved in COVID-19 response since the beginning, conducting surveillance, infection control, contact tracing, engaging in workplace safety guidance, providing alternative housing, and also community engagement. We're watching the data for surges and trends constantly so that we can act on those trends quickly. We're consistently providing guidance to group settings such as nursing homes to help control infections. We're investigating workplace violations and providing public health guidance to workplaces. We're also providing hotel rooms or alternative housing to first responders and healthcare workers so that they can safely isolate and keep themselves and their vulnerable family members protected. And finally, we're responding to numerous inquiries and requests for guidance through community presentations, technical assistance, and via our hotline and our email for the community as well. We're also engaged in planning around the Restore Illinois plan. Governor Pritzker announced this Restore Illinois plan early in May. It's framed as a public health approach to safely reopen the state. It's guided by research and metrics, and it can also be amended when new evidence emerges that directs us to new approaches and strategies. Almost all of the state is following the phases and the metrics outlined in the plan, and it's the same approach that we at CCDPH are also following. We're also monitoring criteria to protect against a resurgence or identify a resurgence. Several metrics are frequently examined to determine the current burden of disease in the region and the region's ability to move to a new phase. So these data are examined over a 14-day or 28-day period, depending on which metric. For movement from a phase 2 to phase 3, for example, from phase 3 to phase 4, we monitor the same metrics. And those metrics include the case positivity rate. So for example, Suburban Cook County must have no more than 8% of all tests with positive results. And that rate must not increase by more than 10 percentage points over a 14-day period in order to move to the next phase. We also monitor hospital capacity data. And looking at hospital capacity, a region must have an available surge capacity of at least 20% of total ICU beds, medical and surgical beds, and ventilators. And we're also monitoring testing and tracing. Testing must be widely available for groups at risk, like those we mentioned earlier, and including first responders and those with underlying conditions. And contact tracing for them must begin quickly. So as you'll hear more today, we're currently in the process of ramping up our contact tracing program for Suburban Cook. So I'm sure a lot of folks on the call are familiar with contact tracing, but in case not, it's not a new program. It is a best practice rooted in public health. It's previously been used widely for other communicable diseases such as syphilis, TB, and measles. Next slide. And here's a little bit of additional detail about how it works. So it's a multi-step process of identifying, assessing, and managing persons who have been exposed to a positive COVID-19 case and connecting those persons to resources to assist them during quarantine. So the process begins by interviewing people who have tested positive for the virus and assessing their ability to safely isolate. We also evaluate other potential needs that they may have during isolation, such as housing, food, personal care, etc. The second aspect of contact tracing is to create a list of individuals with whom they have been in contact during their infectious period. Then we notify those contacts about their potential exposure. Once those contacts have been identified, we reach out to them and provide guidance and appropriate steps that they can take to protect the public, including quarantine. And we can also connect them to other resources for their needs so that they can safely quarantine as well. Our contact tracers and other staff stay in regular contact with those exposed individuals, normally using phone calls, text messages, and/or emails. In doing this, we ensure that any contacts with symptoms are identified as quickly as possible so that appropriate public health action can be taken immediately. So testing, tracing, and quarantine and isolation work all together. But obviously, as you can tell by the process, our contact tracing program is only going to be as effective as the information that we are able to glean from those that we call and reach out to. And that's why trust is such a critical piece of this process. And that's where you all come in. Thank you. Next slide. At this juncture, we have a real significant need to expand our ability to do contact tracing. Our ability to return to a new normal really depends on our ability to identify new cases quickly with widely available testing, which is opening more and more with each day. We have to conduct robust and timely case investigations and contact tracing. And we have to isolate and quarantine individuals and provide wraparound services as needed. So an expanded team of contact tracers in Suburban Cook is going to be crucial in the process of safely lifting regulations and increasing COVID-19 testing, which will inevitably raise the number of positive cases requiring case investigation and contact tracing. Okay, and finally, while CCDPH can handle most of the events under normal circumstances, we're really working hard to ramp up our contact tracing program to levels that this pandemic requires. So we have received a $41 million grant, and we are at this juncture putting $5.5 million into the community. The grant will be for a one-year period. The year technically started on June 1st and goes through May 31st, 2021. And this grant is largely focused on implementing contact tracing for the residents of Suburban Cook. And as Rebecca mentioned, we've contracted with Hektoen to provide oversight and management of the Suburban Cook County COVID-19 Community Supports Program. Hektoen was chosen because they have a long history of partnering with the county and of managing grants. And so with that, I'll turn it over for more specifics about the RFP and those details to Rebecca.
Thank you, Jennifer.
Thank you.
To touch a little further on what Jennifer was just speaking of, to ensure the success of the Cook County Department of Public Health COVID-19 Contact Tracing Initiative, the Suburban Cook County COVID-19 Community Supports Program is designed to support community-based organizations, or CBOs, as credible, trusted entities in sharing timely and evolving COVID-19 information and providing resources to communities and populations in Suburban Cook County, especially those most impacted by the pandemic. The goal of this grassroots, community-driven program is to establish a community-centered system for bi-directional communication that elicits real-time feedback and response based on community experience related to COVID-19, to increase the number of communities that are following healthy and safe practices, and to increase availability and accessibility to testing. Nearly $5.5 million will be awarded to successful applicants who demonstrate strong partnerships and the ability to quickly implement activities within the 6-month period that will result in successful outcomes. Important dates for the projects are summarized in the RFP at-a-glance document and are as follows. September 21st, letters of intent are due. The letter of intent is strongly encouraged to support us in determining the number of reviewers we will need. We will discuss later in the presentation on how to submit LOIs and applications. Applications are due on October 2nd by 5 p.m. Awards are anticipated to be announced the week of November 9th, and the project period is set to begin on December 1st, 2020, and end on May 31st, 2021 for a 6-month period. Before we describe the program and what the RFP supports, we wanted to review eligibility criteria. Eligible applicants are suburban Cook County serving community-based organizations with the exception of Evanston, Oak Park, Skokie, and Stickney Township, as they have their own state-certified public health department and contact tracing programs in place already. As defined in the RFP, a community-based organization is a 501c3 not-for-profit organization that has demonstrated service delivery to specific populations or community areas. Additionally, award recipients must have the organizational capacity to conduct the work described in this RFP and have the fiscal and contracting capacity, as well as the accounting and administrative controls necessary to effectively manage a grant. Requirements include financial stability, fiscal solvency, the ability to provide separate reporting for use of funds, and staff to oversee the scope of work and comply with the contracts. The key themes of this opportunity are to slow the spread and lessen the social and economic impacts of COVID-19, to authentically engage the community, and to reduce health inequities. As listed on page 8 of the RFP, you can find our map of priority populations and communities for the project. The data includes the COVID-19 Community Vulnerability Index, disease burden, and disproportionate impacts. Other populations and communities outside of these priority areas will be considered with strong justification in their applications. There are two options to apply within this RFP. Option 1, participation in a regional learning and action network. And option 2, which includes both participating in a regional learning and action network and the provision of community supports. If you elect to further support beyond joining the regional learning and action network, additional community supports may include education and outreach, programs and services, and/or testing. All applicants will be expected to participate in a regional learning and action network. These networks of CBOs will be established in each region of suburban Cook County. They will meet 1 to 2 times per month and cultivate the sharing of information between CCDPH and other CBOs, and will identify and act on the resources needed in the community. The networks will support the dissemination of COVID-19 related information to their communities. Please use the map on page 16 of the RFP to determine which region you are proposing to serve. In option 2, if you elect to provide the additional support of education and outreach, you will be expected to establish and execute a localized outreach and education program or campaign using the materials developed by IDPH or CCDPH. The goal of this support is to gain the public's trust, provide an understanding of contact tracing, and dispel any related myths. For programs and services, the goal is to slow community spread and minimize the impacts of COVID-19. CBOs will have the option to expand upon an existing program and/or provide direct service that can help households to self-isolate or quarantine, or to lessen the social and economic impacts of COVID-19. CCDPH will explore opportunities for coordination with the care coordination team upon CBO selection. To provide the community support of testing, CBOs would assist to identify who has the virus and supports community-wide testing at existing sites and testing in congregate settings. CVOs would have the option to, 1, develop, manage, and conduct a comprehensive testing program at congregate settings, and or 2, build current testing capacity for increased community-wide testing. During the project period, community contractors will have access to technical assistance, training, and networking opportunities. CCDPH and a select network of partners will be ready to help implement projects. Training opportunities include the Equity Lab, titled Changing Hearts and Minds for Leadership, which is a series of 3 online sessions held over the course of the project period by CCDPH staff and partners. At these sessions, community contractors will augment their knowledge, skills, and resources to meet program deliverables, advance other projects in their organization and respective communities, and support sustainability of the regional learning and action network. Community contractors will also have the opportunity to cultivate vibrant relationships within their regional learning and action network and with other CVOs across suburban Cook County. Additionally, this opportunity will provide benefits beyond the project period, including but not limited to increased organizational capacity to sustain or expand community health initiatives, new partnerships to collaborate on future projects and funding opportunities, and an ongoing bidirectional relationship with CCDPH via the regional learning and action networks beyond the community contract period. Award recipients may be awarded the following funding. Option 1, awards will be $20,000, and option 2, awards will be between $50,000 and $300,000. Award sizes for option 2 may vary based on factors such as the defined project area and need, the scope of work, including priority populations and communities reached and partners involved, and the total number of people impacted. Budgets are required for option 2 and must reflect the scope of work proposed. Funding may be used for personnel, including fringe benefits, supplies, travel, contractual costs, equipment, and other costs associated with your activities not covered in other categories. Funding may not be used for research, construction, the delivery of direct service to clients or clinical care, lobbying, general management or administration costs that do not directly contribute to the implementation of the initiative, direct fundraising, such as special events, direct mail campaigns, or the solicitation of donors, activities for inherently religious purposes, and or the reimbursement for pre-award costs. All community contractors in both options 1 and 2 are expected to identify one individual to be the lead liaison between Hektoen and CCDPH, and one individual to serve as an alternate liaison. They are also expected to engage in 1 to 2 regional learning and action network meetings per month and 3 online sessions of the Equity Lab. They are expected to disseminate relevant information on COVID-19 and complete a monthly report to capture dissemination and participation efforts. They are also required to participate in any contractor meetings and evaluation activities that may come up during the project period. As expanded support, option 2 awardees will have the same deliverables and obligations of community contractors funded under option 1, plus option 2 awardees must also implement a work plan outlining populations, targeted and specific implementation steps, measuring progress for your program, as well as disseminating information describing outcomes, lessons learned, and best practices. They are also required to submit monthly progress reports and expense reports for reimbursement by the 15th of each month of the project. If you're interested in applying, we strongly encourage you to submit a letter of intent using the online form linked on page 13 of the RFP and on the application website. The LOI is not required, but will help us collect preliminary information on applicants that will help us determine the number of reviewers we will need. The proposal is broken down into 5 total sections: basic information, proposed project, work plan and budgets, letters of support, and certification. As option 1 is less intensive, applicants are only required to complete the basic information and certification sections. Option 2, applicants will be required to complete all 5 sections and required attachments. In addition, a risk assessment must be submitted, which is linked on page 14 of the RFP and on the application website. As a quick note, there is a correction in the RFP which stated there were 6 sections on page 13. There are indeed only 5 sections and a risk assessment required for option 2 applicants. We have made that change in the RFP and have uploaded that to our website with a note on the date that it was updated. When considering applying to this RFP, please think of how the proposed activities will address health equity issues, the degree of need within the community, the reach of activities proposed, how this proposal uses existing or builds new programming and includes direct community involvement, the degree to which the proposal is tailored to meet community needs, the degree to which your proposal builds sustainable activities, and the ability of your organization and its partners to start your activities rapidly and complete your work within the project period. Your proposal should speak to the following questions and issues, as they may affect how your proposal is evaluated in the context of the larger goals of the Suburban Cook County COVID-19 Community Support Program. As mentioned previously, the deadline for this opportunity is Friday, October 2nd at 5 p.m. Central Time. Any application submitted after this time and date will not be reviewed. On the application website, there are 2 separate applications to apply specific to each option. All applications must be sent through our online system. Please note, unfortunately, our application system does not have the option to save. We recommend you enter your application in full only when you are ready to submit. To view the application questions and required documents, please see Appendix A in the RFP. This includes all the questions asked in the LOI, application proposal, and risk assessment for option 2. As indicated, the risk assessment questions was added to Appendix A just yesterday. If the RFP is updated at any time, you will see a note on our application page. As indicated before, unfortunately, our application system does not have the option to save. We recommend you enter your application in full only when you are ready to submit. Failure to follow any of the instructions related to content may result in the proposal being eliminated from consideration. Common reasons for proposals not being being considered include late submission, incomplete submission, and the failure to include the required documentation. After the proposal submission deadline, all proposals will be screened for eligibility, completeness, and technical requirements. Applications that pass the initial screening will be subject to panel review, where they will score applications based on quality and recommend full, partial, or no funding. Hektoen and CCDPH staff will assemble a set of proposals recommended for funding. The selection will be based on scoring, as well as achieving an effective and integrated mix of activities, geographic distribution across suburban Cook County, the inclusion of communities of populations disproportionately affected by rising rates of obesity and associated risk factors. We may also identify partnerships and coordination needed in order to receive funding. During the week of November 9th, Hektoen plans to authorize the award of contracts to award recipients and notify each applicant of the decision about their proposal. Please note, this time period is our anticipated timeline and is subject to change. You may ask questions and request technical assistance via email at cborfp@hektoen.org. Responses will be added to a list of frequently asked questions posted on the Hektoen webpage. All questions or requests for technical assistance must be received by 5 p.m. Central Time on Tuesday, September 29th. Questions and responses from the information session will also be included on our FAQ. For questions about the RFP and how to apply, updates, or to download forms, FAQs, and other resources, please visit the Hektoen website and the COVID-19 initiative page listed above. This information session will be available as a recording online and will be posted to the Hektoen website at a link posted on our COVID-19 initiatives page. If you have any questions, please enter and ask using the Zoom chat feature located at the bottom of the Zoom screen or by pressing Alt-H. I'd like to turn it over to Gina Masuda Barnett, who will moderate the question section.
Great. Thanks, Rebecca. As was shared earlier, it's great to see the level of interest. Please do write your questions in the group chat feature, and keep in mind, if we are unable, if Hektoen or CCDPH is unable to answer the question fully today, we will make sure that it gets addressed in the FAQs that will be posted up on Hektoen's website. Okay, so the first question I saw, and this will be directed to you, Jennifer, what are the metrics for contact tracing that Cook County is using?
Thank you, Gina. Can the individual that asked that question give a little bit more specifics? Metrics in terms of people contacted, or?
This is Rebecca. Everyone's muted, so if you did ask the question, and if your question needs to be elaborated on, please unmute yourself, and you can speak to us directly.
Hi. Hi, Jennifer. It's Abigail. How are you?
Hi, good. Thank
Good.
you. Good morning.
Yes. Good morning. So yes, the proportion contacted, right? And then the turnaround time, like, achieving, contact within 24 hours, 48 hours. That's what I'm wondering about.
Okay, sure. So at this point, we're still kind of analyzing the data coming out of our communicable disease team and all of the case investigation and contact tracing that they've been doing since the beginning. So as we continue to onboard additional case investigators and supervisors and contact tracers over the upcoming months, we are working on formulating those metrics and what is achievable in terms of how many case investigations, per day, how many contacts can be traced per day. Obviously, it's going to vary a little bit based on personal circumstances of that particular case. And we're also looking at data about when people are more reachable. So the short answer to your question is those metrics are still being developed, taking into account those data points in addition to others.
Thank you.
Sure.
Great, thank you. Okay, Jennifer, this question is directed to you again. If we do community testing, what are the expectations with regards to contact tracing?
So the contact tracing is going to be done by CCDPH employees. So the expectation, would be that if there is data that comes out of the testing events, that is shared with CCDPH. We would want to understand, the plan for the testing event or the testing opportunities, the outreach that is done, the promotion that is done, and the results and the attendance. But for the most part, once individuals are tested, those results travel through, via the state of Illinois, would travel to CCDPH, and it's our internal staff that would do the actual tracing. Does that make sense? Gina, please feel free to jump in if I missed something.
Yeah, no, I think you summarized it well. I think ultimately those that are conducting testing will provide those results in INEDs. And just from an ethical standpoint, making sure that, appropriate communication is circled back with the individuals who receive testing. So great. Okay. Next question, and I think this can go to Hektoen and CCDPH, and I believe we might need to get back to respond to this through our FAQs, but I will ask it. What are the credentials necessary to be considered a qualified tester?
Would that be for just a contacts? Or, oh, I'm sorry, a tester. I'm not sure on that. I know what our requirements are for contact tracers, but for testers, I think as far as Hektoen has, we would have to get back to you. Jennifer, do you have any knowledge on that?
So testing has been done by nonprofits and FQHCs partnering with labs, or sometimes healthcare providers do have their own labs. So I would say that there needs to be obviously a connection to a lab that can actually, test the samples, but we can get additional details for you, or if you can elaborate on that question, maybe that would help us answer that more clearly.
Okay, can I elaborate on the question?
Sure.
Yes, please do.
Okay, I submit, this is Marvin Koklow from Elite Houses of Suburban. Because a lot of times, in the processing of the results and the actual testing are two different things. So where you might be able to partner with a lab who can process the collection, the issue of who's doing the collecting and what their credentials are can be a key point of making sure that you get accurate collections done. So does that person need to be a medical person, or train an individual trained by somebody in the testing or confirmation field on how to, to actually collect? Because particularly if you do an SCR testing, that's fairly invasive versus say an antibody testing, blood drawn, you can get, a lab group to do that. But a more invasive test really does require a certain skill and certainly some training. Along with that, a person, I guess, would have to agree to be tested, and then, of course, HIPAA and everything would follow into there. But they had to believe that when they come to a test unit, that qualified people are collecting these samples. I mean, doesn't that make sense?
Mm-hmm. Thank you, Marvin, for clarifying. I think given the question, we will get back to you and the group through the FAQ in a more extensive fashion.
Mm-hmm. Thank you.
Okay, thank you for asking that question. Okay, the next question is, are we allowed to continue using the lab that we currently use for testing? And I'll just direct it to both Jennifer and Rebecca.
This is Rebecca. I would say yes. I think in your budget, you will have to make some kind of a subcontract with them, and the metrics would have to maintain separate from the testing that you are already doing with them. So, the data would have to be separate and the funds would have to be reported separately. Jennifer, if you have any other items to say, feel free, but I think that would be an allowable.
Yes.
Mm-hmm.
Yes, I agree.
Great. Rebecca, the next question is for you. What is the criteria for a community-based organization?
Of course. So our community-based organizations, we do ask that they are 501c3s and that they are already connected in with the communities and are in the populations served. Give me just a second, I have verbiage. As we mentioned before, eligible applicants are in suburban Cook County and are excluding Evanston, Oak Park, Skokie, and Stickney Township. In the RFP, we define them as a 501c3 not-for-profit who has demonstrated service delivery to specific populations or community areas. And then we would also, ask that the capacity is there as well for fiscal and reporting to take on a project of this size.
Great. Thank you, Rebecca. The next question again, Rebecca, does the Hektoen website contain the RFP?
Yes, yes, it does.
Okay.
You can find a link on there. I believe we have it highlighted. And as I mentioned previously, if there are any updates at any time, you'll see a little note on there as well, with a new link to the updated RFP to download.
Okay, great. Thank you. The next question again, Rebecca, is for you. Can you clarify the difference between option 1 and option 2? For example, our organization serves vulnerable seniors with housing and social service programs. If we choose option 1, can funds help expand our existing programs, or would we need to choose option 2?
Yes, of course. So using this example, you would definitely be able to apply to either option. For option 1, as mentioned, the funding would be $20,000 in participation, with the startup costs being $5,000 upon contract execution and $15,000 at the end of the project period, which is dependent on participation in the regional learning and action networks, as well as participation in the equity lab, and any other deliverables that may be added during the project period with CCDPH. So for your example, yes, you could use the option 1 funding for expanded support in your program. However, if you did want and have an idea for a proposed project that goes over that $20,000 funding cap, then I would recommend applying for option 2. And just for the ability to provide further services and more funding to your organization.
Okay, Rebecca, the next question goes to you. For both options, do they require disseminating COVID-19 information to clients?
Yes.
Okay, thank you. Not related to the RFP, there is someone that wants to know how to apply to become a contact tracer employee. Jennifer, could you answer that question, please?
Yes, there are postings on the Cook County Health and Hospital System website. Currently, there are some specifically bilingual postings still available. Additionally, leadership roles will continue to be posted for the contact tracing initiative in the coming weeks.
Great, thank you, Jennifer. Okay, Jennifer, this question is, or I guess it's to both CCDPH and Hektoen. Is an example of a viable program partnerships utilizing our existing food pantry for training, testing, and contact tracing? Pastor Jeff, could you expound on your question, please?
Okay, so yeah, I will. You can hear me, right?
Yes, we can hear you.
Okay,
great.
so we currently have a program that's in the South Suburban area that we've had for over 30 years. And so what I was wondering is if we were to utilize the families that come to that particular food pantry, which generally is 100, about 400 individuals total, but maybe we may get 160, 170 cars that come every week. Could that program be used to be able to provide the testing and like whatever the training elements, and as well as the contact tracing to create a program that is viable for what you guys are attempting to do?
Mm-hmm.
So Gina, I would ask for you to jump in here, but I do know that one of the aspects of the RFP that was contemplated was expansion of existing programs.
Yeah. So I think for clarification, we are looking to partner with community-based organizations because of their credibility and trust within communities. And so, again, just to reiterate what Rebecca reviewed earlier, really it's about either conducting education and outreach, program or campaign. With the expansion of programs and services, it really is about really, again, trying to lessen the impact of the social and economic impacts of COVID. And then the testing. So the testing has, as I think, was discussed earlier, there are different criteria and sort of expertise that's needed in partnerships in that space. So again, Pastor Jeff, we can't answer your particular question, but I think what we can say is that if you have, you want to be thinking about the partnerships you have access to and how you can expand upon the work you're doing within the food, your food pantry. And then just wanted to reiterate that contact tracing will be conducted by CCDPH staff. So I know this is a different model than is being used by the city of Chicago, which has is in the process of contracting with CBOs for them to do the contact tracing. We are not doing that within this model. I hope that's clear.
That's it is helpful.
Okay.
Because what we did, just for an example, last week with our food pantry, we of course when people come to get the food, and we have a partnership with the Chicago Food Depository, and it's connected to our church, of course. So we added distribution of school supplies, voter registration, and we also had COVID testing through Family Christian Health Center.
Okay.
So we did that on this past Friday. So as you were talking about, and going through the presentation, that's what really kind of it was in my mind that could be a part of this effort.
Yeah. Yes, thank you for sharing that. And I think if you want specific technical assistance, please direct your question to cborfp@hektoen.org. But again, just I think for the entire group, to just be mindful of the existing programs and services you already have in place, the partnerships that you have access to that could extend your impact and reach in the areas that we presented earlier. So, okay. The next question is churches within, and so this is to you, Rebecca, churches within the state of Illinois are typically recognized and approved as nonprofit organizations. Many local churches provide community services and may not have applied for 501c3 status. Are these nonprofit entities eligible to apply?
I will have to confirm completely on this question, but I do believe that you should be, as long as any not-for-profit organization should be acceptable to apply. As we discussed, research is not to be used for any inherently religious purposes, but if the scope would be more on community support, I believe that that would be allowable.
Okay. Thank you, Rebecca. Okay. The next question is, should liaison be funded agencies, staff, or partners? Eula, could you clarify your question, please, so I can direct it accordingly?
I just, there was reference to liaisons. So I'm just wondering, would that be your staff, or could a partner agency be a liaison? So I want to have a clear definition of what's meant by liaison. In my mind, is somebody who represents something. So I just want to know how you guys are looking at liaisons. And if we have partner agencies, are they supposed to be the liaisons or your staff? How does that work?
Gina, I can take this question.
Okay, great.
For our deliverable, or as one of our deliverables, it would be someone within your organization to be the direct contact between or for Hektoen and CCDPH. So we ask for a primary liaison, a primary contact and an alternate contact, just so we can have regular communication between the chosen individuals and versus, having multiple contacts per organization. Does that make sense?
Yes, that makes sense.
Okay.
Thank you.
Thanks, Eula.
Yes, I have a question. This is Deborah Vance from The Answer Incorporated.
Uh-huh.
I did read the criteria of the proposal, and my question is, are we able to, like, say for instance, provide services for individuals that have suffered, like, maybe mental health issues from COVID-19? My agency services families impacted by autism and developmental differences, and a lot of them have mental health issues as well. Mm-hmm. So I wanted to know if that was doable.
I mean, from a broader perspective, individuals with, mental health are, I think, one of the priority populations. And so I think that we can't answer that question directly, Deborah, without knowing what your proposal would encounter. So again, if you'd like some technical support, please directly email cborfp@hektoen.org, and we can offer that support.
Okay, thank you.
Okay. The next question is, CBOs may do outreach, education, testing, but actual contact tracing will be done by CCDPH staff. And just again, to reiterate, that is correct. CCDPH staff will be doing contact tracing. Okay. The next question is, and I think this is directed to you, Rebecca, should three partner agencies receive funds from the funded agency? Again, Eula, can you maybe expound on that question?
Sometimes partners, when you reference a lead to me, I know that's a lead agency, but sometimes when a lead is referenced, that means some of the other agencies may also get some of the funds from the lead agency, through the lead agency. So if you have agency and two partners, the lead agency may give funds to the two partner agencies or the three partner agencies. So that's what I was inquiring about. Is that how it will, is this doable or not doable? How would that actually work?
Okay, thank you for clarifying. Rebecca, can you respond to that question, please?
Yes, of course. So yeah, I think that you just explained it very well. So if I'll use you as an example, Eula. If your organization proposes a project and has 2 additional partner organizations that are contributing to the work of your proposal, then we can include them into the budget, and they would be paid under your organization as a subcontract. In addition, or just to clarify, those partner organizations could also apply for their own proposal. However, that would be, separate work and separate funds that are not meant to overlap. So if one of those partner organizations offered testing, but they were also helping you with education and outreach, that would be totally doable. But if they wanted to use the same education and outreach numbers, that we would not allow. Does that make sense? Or if you have any other questions?
Yes, that makes sense to me. Okay, thanks a lot.
All right, thanks.
Great. The next question, and Jennifer, I'll direct it to you, is to confirm CBOs are doing the testing and CCDPH is doing the contract tracing, which is yes. If so, what data system will be used to track and share this data? Will CCDPH be providing the tests? Do applicants need to budget for tests? And will CCDPH set up agreements with the labs to process the tests?
Okay, thank you. So I'll take several parts of that question from Blair. Thank you, Blair, for those very specific questions. The CCDPH is doing the contact tracing as we mentioned. And apologies, we should have probably gone into a little bit more detail about this earlier, but when testing is conducted, the results are sent to the state of Illinois. So whether you are using, one of the commercial labs or contracting with a hospital that has their own lab, those results do get sent automatically to the state of Illinois. So that's the INEDS system that Gina referenced earlier. And Gina, I would just ask you to jump in with more details on INEDS if necessary. But additionally, the state has provided all departments of public health across the state with access to Salesforce. And Salesforce is the mechanism that is used to distribute those positive cases to departments of public health. So the data systems that are used are INEDS and Salesforce. Additionally, I'm going to skip the next 2 questions and ask for Gina's assistance with those. I can say, I think pretty confidently, in terms of helping set up agreements with the labs, we are not able to do that at CCDPH. Gina, can you jump in on the other 2 questions
Sure.
about whether we have the ability to provide tests to applicants and whether that needs to be budgeted?
Yeah. So I think just know we will not be providing tests. Applicants do need to account for, the supplies that they need to conduct testing. I did want to add, though, one thing that CCDPH will be doing in the space of testing is coordination. And so we will be making sure that we have more of a, engagement and understanding of what is happening across suburban Cook County, alongside the CBOs that will be conducting testing and other healthcare entities doing that.
So Blair, did that answer your questions? Okay, if you have additional questions, continue to use the chat. One thing that we wanted to point out, just for clarity, just based on some of the questions that are coming in, is that testing is not required for both options.
Thank you for that clarification, Jennifer. This is to Hektoen and to CCDPH. What are the expectations for outreach and education?
Of course. So for outreach for education and outreach, you will be expected to establish and execute a localized outreach and education program or campaign using the materials developed by IDPH or CCDPH. The goal is to gain the public's trust, provide an understanding of contact tracing, and dispel any related myths. So when we do, with reporting and everything for option 2, we will have metrics based on the work plan that is submitted and approved during the application review process.
Thank you, Rebecca. Jennifer, do you have anything to add to that?
No, not at this time. Thank
Okay.
you.
Thank you.
Good.
Rebecca, the next question is for you. Can you change from the option indicated in the LOI?
Yes, of course. The LOI is not binding and it's not required. It is just highly encouraged that you submit it, and we really just are looking for preliminary information for what kind of applications we will be receiving. But yes, it's not binding, and you can change your options at a later time for the application.
Oops, sorry, I was muted. I was like, why isn't anyone responding to me? I apologize. Rebecca, this question is directed to you. Can a CBO utilize a fiscal agent in the application?
Yes, that will be possible so long as the fiscal agent has is a not-for-profit or a 501c3 organization.
Okay, thank you. The next question, I think, which Jennifer indicated previously, would we be required to conduct testing? If you select option 2, as Jennifer indicated earlier, no, you are not required to conduct testing.
I'll add a clarification on that too, Gina.
Okay, yes, please.
Yeah. For option 2, there are 3 opportunities to apply. You can choose one, you can choose all 3. It really depends on your proposal and your proposed project.
Yeah, okay, great. Okay, sorry, I'm just trying to scroll through all the questions. Okay, so Rebecca, this is to you. Just clarification again around the definition of an eligible CBO. Based on what you're sharing, are we broadening the definition?
I would say no. As defined in the RFP, you know, it is a 501c3 not-for-profit organization with demonstrated service delivery to specific populations or community areas. If you are in a separate category from that, or if you have any clarifications to make, please email us at cborfp@hektoen.org, and we can discuss further, you know, if there's any technical aspects regarding that question, regarding if you are eligible or not.
May I interject?
Of course.
So I submitted the question, and it was based upon the conversation that you had with the pastor. Not with the, I think with the pastor, and they were talking about, or someone was talking about their church not having applied for a 501c3. And I thought that the 501c3 was a part of your definition, or in the RP's definition of a CBO. But if it's not a part of the definition, it would suggest that you are broadening the definition and maybe almost checklisting it. Yet, that you have to demonstrate, say, that you have community outreach, that you are, or something like that. But you don't have to be, your status doesn't have to be, from a tax standpoint at least, that you are deemed corporately as a non-for-profit. And that changes, if that's the case, that changes completely from what I read in the RFP, eligibility, the definition of eligibility. So that's why I'm asking, are you broadening the definition? Because it seemed to be suggested that the church that did not have a 501c, the fact that they're a religious-based organization would be enough to qualify them, but that's not what the proposal is saying.
Yeah. Thank you for raising that. We will clarify that in the FAQs.
And this is Jennifer. I would also just add for emphasis that we are also encouraging partnerships among organizations and among CBOs. So that's just also something to keep in mind as you're developing your proposal.
Yeah.
So are you suggesting that, as an example, a community-based organization could partner with a for-profit organization, but the community-based would be the lead?
We can expand more on this in the FAQ. Yeah, let me get back to you on that.
Thank you.
Excuse me, may I ask a question on this issue?
Correct. Yes, please feel free. Go ahead.
So thank you. I am the one who posed the initial question regarding whether or not a state of Illinois church, I've had this occur recently with some grant funding that I specifically took the lead on. And I worked with a couple different churches, and one in particular was awarded the grant, but I realized then that that church was not recognized and did not have 501c3 status. However, because they were recognized by the state as a non-for-profit organization, we were able to continue on with the proposal that was submitted. And if this is an issue that you cannot clarify here, because the first responder to my question led me to believe, as the young lady just suggested, that there was an extension, if you will, or a shift in your requirements. That's the main reason why I asked. And if this is an issue that cannot be clarified here on this call, I would certainly ask and propose that it be considered, because there are a lot of local community-based churches that are servicing the community. They are active, they're up and running, and because they have not extended to apply for 501c3 status, I just think it would be unfortunate that they would be excluded from this opportunity to serve. Thank you.
No, thank you for raising it, and we will respond in the FAQ. Thank you. I just want to Rebecca, this question is for you. How many awards are expected?
That's a good question. I believe that we have, we're anticipating, I would say, roughly 100 awardees. However, I do think it is dependent on the applications that we receive. For example, if we receive more applications for option 1 than option 2, or if we receive more option 2 applications and option 1, it really is dependent on the community need for what proposed projects are needed for our priority populations.
Okay, thank you. Again, the next question is related to testing, and is it required? No, testing is not required for option 2. Option 1, again, is solely about participation in the regional learning and action network and the supports around dissemination of COVID-19 related information. Okay, maybe this is a similar question. It's, what are the anticipated outcomes per CBO and how many are you expecting to be reached?
That is another good question. I don't know, Gina, if you have anything on this. Since we have, I don't believe that we have finalized our reporting and requirements for the selected CBOs.
Yeah, if I could add to that, in the application, you will note that the CBO needs to specify what outcome it's looking to achieve within the context of and particularly for this is for option 2. So again, given the short period of time, we're really looking for CBOs that can that have sort of either education and outreach efforts in place, programs and services in place, have been, whether it's partnerships or actually conducting the testing, so that it really is about leveraging this funding for extension and reach. So we are looking for the organizations to specify their expected outcomes. And then we are going to, be kind of consolidating that and monitoring that throughout the project period.
Yeah, and then I think I also touched base a little on a previous question. We do have a work plan attachment for option 2. So, and in that we, as Gina just mentioned, we ask for what your organization believes that they can do in the proposed project period, which we know is a fairly quick turnaround, but yeah, it's all dependent on your proposal and the proposed work plan.
Okay. The next question is, are partnerships required? Rebecca, would you like to start off, and Jennifer and or I can chime in after?
Of course. Partnerships are not required, though we do ask for a minimum, is it 3, Gina, letters of support?
Correct.
Within the community. As I think we've highlighted, we are really, looking to serve these areas and serve the priority populations. So while partnerships are not required, they are highly encouraged.
Okay, great. Thank you, Rebecca. Jennifer, do you have anything to add to that?
No, I would say that's exactly right. Not required, but strongly encouraged in order to extend our reach and capacity as much as possible.
Yeah. I think the last question I saw was, when can we expect to see the FAQ that we've been mentioning? So Rebecca, can you chime in on that, please?
Of course. We plan to update the FAQ daily. So you can, I believe that any questions that are asked throughout this project period or throughout this application period will be updated by 5 p.m. Daily. And I believe that these questions today you can anticipate to be answered likely by tomorrow.
Did I hear somebody asking a question? Okay. So I think with by tomorrow, just given the number of questions, if you could give us, because I think it's a combination of Hektoen and then also CCDPH as the programmatic lead. So by COB tomorrow, yeah, I think. And then are there any questions that I missed accidentally that folks want to make sure get asked? We do have a few more minutes before this information session concludes. Okay, well, thank you for all your questions. I'm going to turn it over to Rebecca to conclude our session.
Of course. Thank you, Gina, for moderating the Q&A. Thank you, everybody, for attending this webinar. You know, if you have any additional questions, as mentioned numerous times, please email us at cborfp@hektoen.org, and we will get back to you as soon as possible. If you have any questions, you know, please feel free to reach out, and we look forward to receiving your applications and LOIs. Thank you so much for your time, and enjoy the rest of your day.
Thanks, everyone.
Thank you.